let's talk about health. Health, they say, is wealth. You need to be healthy for you to even tap into the wealth in Nigeria's digital economy, or any digital economy for that matter. So the federal government has committed 1 trillion naira to enhance primary health care in Nigeria, and it's also going to train over 60,000 health workers as part of the efforts of the government to improve healthcare delivery, particularly to those at the grassroots. We're talking about how critical the primary healthcare centers are to the health sectors. To look at this and understand what this performance-based fund has been released for the healthcare sector, $1.2 billion, which is about $1 trillion naira, how far this will go in improving the level of the condition of primary health care centers across Nigeria. Let's talk with our guest this morning, who is the co-founder and CEO Pay-Per-Care Healthcare Limited, Brown Matrix Consulting Ltd, and Leadership and Performance Management Institute. So since this fund is performance-based, you could also speak to it along the line. Good morning. Thank you for joining us.
Thank you so much. Thank you for having me.
It's our pleasure. If we look at the role the primary healthcare centers play in, or are supposed to play in Nigerian healthcare sector, and $1.2 billion committed to improving their condition and also training 60,000 healthcare workers, can we say that we're finally getting there in ensuring that those of the grassroots have access to healthcare?
For having me. And first of all, I want to say that the primary healthcare is a very critical component in the Nigerian healthcare system. The Nigerian healthcare system is split into this federal, the state, and the primary healthcare. And about 60% of our population are meant to access the primary healthcare. But unfortunately, that has not been the dynamic. Some of those statements haven't spent about 3 decades in the healthcare space. In the healthcare space, not as a medical doctor, but as someone who sells medical devices and making presentations to chief medical directors across different citizens, the public, in some of their seminars. Some of these statements have comfort, but execution has been the problem. If at all, this, since we are in a new regime, the Tinubu government, if this will be implemented, I can tell you that it's really going to turn around our healthcare system. But the question I also want to ask is that in the first quarter of 2024, Professor Ali made a statement that 50 billion will be released into the primary health sector to revamp the primary health care. How has that done? He didn't speak about that, and now again he's making another statement again that about $1 trillion naira will be released to the primary health care center and 60,000 workers will be trained. Then if I do my mental calculation, let me use Lagos State as a benchmark where everything seems to be working in terms of primary health care and the healthcare system says working. If you do a calculation, you're talking about having about 78 healthcare workers trained across the 36 states, if you have to divide it. So if you split it around that, Lagos State alone has more than 15 primary healthcare. How will these 78 healthcare workers be distributed? And what quality of healthcare workers are they taking there? So to me, I think it's still a question of a policy statement, ambiguous statement, just making statement for just to satisfy those who want to listen to it.
Thank you, Doctor. It's good to have you on set this morning. A lot of people have argued that the dysfunctional nature of our federalism has also been the real challenge here, that the federal government are not necessarily to be concerned about primary health care. Theirs actually should be the tertiary health care. But how do you think that we'll be able to manage these with this distorted federalism where the local government council, especially in the rural area, the chairman lives in the urban center and they only go there at the end of the month for allocation sharing? How do you think we can work around this to really have a robust healthcare, primary healthcare across Nigeria?
First of all, I want to say that, like I said earlier on, I've done presentations across state governors, conference of chief medical directors, and all of it. We are trying to put the horse before the right. Capacity development is critical and it's important. If we really were serious about revamping the primary healthcare, what the government should have done first is to get people trained. Get the people trained, go to the local government and get the health worker and the local government trained and make sure the right infrastructures are there. When they talk about revamping the primary healthcare, you and I know, I'm not the primary working. Most of the primary healthcare centers are not working. Some of them don't even have no table, no desk, nothing. If you go there, you don't see any doctor. So to me, if it has to work, the health minister or the coordinating minister, or whoever is in charge of this, first of all, has to ensure that the local government staff or the healthcare staff in the rural areas, first of all, they are trained. The right infrastructure is in place. Then you talk about then equipping the police. Not saying, oh, we've released 1.something trillion naira, want to revamp the healthcare center. How do you want to do it? Can you in the city, have you seen a model? If you say you want to revamp, show us a model of how it will look like when you're done. We don't have it. Every structure is built for the from vision. This is a political statement, and this is a politician, and so it's a bit difficult because the capacity is not there, the skill is not there. There's a capacity gap. The leadership vision is not there in the local government. So how do they intend to do it? It will just be another policy statement. At all, if money is released, then they will share it and go home with it, and nothing will happen. In this country, we heard about the Vamet project. Where are the equipment? Nothing happened. Nothing happened. They allocate money, the money, they give it to the friends, they supply devices. More often at times, they don't even supply the devices. They still leave the same place the way it is, administration to administration. If the present administration is serious about revamping the primary healthcare center, which is critical to the development of any healthcare infrastructure or ecosystem of any country, and also to bring about what? Sustainable healthcare in this country, and also reduce the infant mortality rate, the government should first of all come up with a training plan of the local government staffs or those that will be there and provide the necessary environment. No doctor, no healthcare officer will go to the local government and work in an environment that is not conducive, an environment that is not fit for living. There is no light. There is nothing. You want to send them, they will not go.
That's well said, Doc. There's also this other issue where the most hit sector of the Jackpot syndrome is actually the health sector. And people have argued because of poor remuneration in that particular space. Now we're also talking about people going to the rural areas to work. There's this fellowship program that the Federal Ministry of Health has also put in place, and over 360,000 people are said to have enrolled into the fellowship. Are you sure this will be able to bridge that gap?
Now, in my dissertation, when I was doing my PhD, I spoke about the workforce staffing and leadership in the healthcare sector. The challenge we have right now, the Jackpot syndrome will not be reduced until the leadership crisis in the healthcare sector is addressed. You expect a medical doctor who has been trained to work with people who do not care about his welfare. A doctor goes to the clinic or the healthcare, the equipments are not there. The doctors are being trained without being exposed to the latest technology. And even if they are exposed to the latest technology, their leaders are autocratic. They don't take the condition, the welfare of the healthcare workers into consideration. They think about themselves. The Jackpot syndrome will keep going up. We need to sit down and be serious about our healthcare system. And what I tell people that care to listen is that you pray that you don't fall ill. Most of the innovation today we see in the healthcare space are not spread. You can't get them in Lagos is a unique location, both from the private and the public healthcare system are well equipped, functioning very well. But you can't get the same thing if you go to even a nearby states. Some nearby say, what you get in Lagos, Lagos is a model city where doctors are investing, maybe because of the multiplicative nature of Lagos State. Doctors are buying CT, MRI, upgrading their theaters, making sure it's up to class. And also the same thing is applicable to the general hospitals in Lagos State. Today, go to a general hospital in Lagos State, you'll be glad to go there. The primary healthcare center are well equipped. They run 24-hour services. 24-hour services. You have a panel over their roofs. There are doctors who are there on duty. They do all manner of investigation because the government has intentionally worked with a blueprint that they want to run with it. But on the federal level, do the state government or the coordinating minister has a plan for that? So the doctor syndrome will keep improving. How much are our doctors paid? My father was a medical doctor. I grew up to know him as a medical doctor. Then when I was in primary, what happened? As soon as he went to work one day, he came back with a Peugeot 504 as a medical doctor. He was able to give us a hope, build a roof over our DC. Over us when we were there. We were not stranded, we were not living outside. He has a quarter where he was living. He has workers that were working for him as a medical doctor. So he had that joy of going to work. But today, I don't think Nigeria is prepared yet. The Japa syndrome will keep increasing until we do the needful. If I have a brother or a sister who is in the health space and he goes to work, if the working environment is not okay, a toxic leader who does not care about his welfare, but only think about their pocket, I won't advise him to stay until the needful is done.
Without attending to the welfare of the doctors who will be carrying out the job. Because even the machines needs to be operated. Even the equipment, the doctors that are going to use them need to be trained. And it must reflect in their remuneration. Just the way the tertiary healthcare centers are meant to take care. Okay, doctor, if you're back, can you hear me now? Can you hear me?
Yes, I can hear you. Go ahead, I can hear you.
Okay. Oh, now I can't hear you. So, okay, if you can hear me, this was the question I asked in the first place. That now we're talking about 1 trillion naira. Previously, before now, we saw $933 million. And there are issues of the 50 billion naira that you referenced, about 400,000 workers that needs to be trained, and how the health minister, Professor Ali Pate, came out to talk about it. Now, I am trying to explore your leadership and performance management side. How can we efficiently utilize these funds for it to really treat the inconsistencies and the anomalies that is bedeviling the health sector in our country, and see that these funds, translate to curbing these problems and it reflects in the health sector of our country?
Thank you for that question. First of all, we have to start from healthcare vision. We have to start from healthcare vision. I will explain it. They said we must have a healthcare vision or a national healthcare vision of what we want to do. We now have to set KPIs, not policy statement. We know the number of teaching hospitals that are in Nigeria. We know the number of general hospitals that are in Nigeria. The number of primary healthcare in Nigeria, we are not too sure. But I want to take a benchmark of, let's say we have about 15 primary healthcare centers in every state. We set up our target and tell ourselves, okay, fine, in this state, we want to implement XYZ. And in these primary healthcare centers, we want to buy this, buy this, buy this, buy this. These are the healthcare workers we want to train. This is what we'll provide and all of it. We atomize it and have it, we make them public. Break the entire implementation plan into phases. We start with X number of states. We execute it. And we come up with a plan and ask people to go and check and make sure what we are saying, we are really walking the talk. After that, we move to the next phase. If it is not done, either the president or whoever is in charge will hold the health minister accountable, or the population or the people will hold them accountable. That you said this, you did not do it. The point is, we make statements that are not backed up with the execution plan, and they are not KPIs to measure what we are doing. Anything that cannot be measured cannot be tracked. 1 trillion, fantastic. How do we measure it? How do we track you? Are there KPIs somewhere? Is there anywhere I can log in to find out what is happening and what state are you executing this project and who is the person in charge? When these things are not there, it is difficult. If I thought the money is released, because this money is not assigned to specific deliverables, people will still go there and paint the building and tell you they've renovated a primary health care center or they've done something. But when they are tied to, I give you 10 naira, I say you will buy an operating light. I go there and I see the operating light, and not just any operating light. The operating light must have specification that meet global standards. And this operating light must be durable, not one that is made somewhere that you bring after some time, while the doctor is carrying out the operation, the doctor will be sweating. That need to, until we get that all clear. Now, okay, I operate in the public sector, right? Not in the private sector. I beg your pardon, I operate in the public sector. I have my team across Nigeria and Ghana. We all work remotely. We have our KPIs. At the beginning of the year, we hold our strategic meeting and agree on what to implement. These things are cascaded down to even the lowest person who knows what you're supposed to do. Every Friday, we meet to review and ask ourselves one question: are we on track? If we are not on track, why are we not on track? Where have we gotten it wrong? Then we realign our strategy and our implementation plan. That's all about performance. When a country cannot do that, forget it. We are going nowhere.
Very much. Now, this is probably my last question to you, as long as this is concerned. Now, I like the vision you spoke about. It's quite, articulate. The thing is, in all this, if you envisage the government and the nation to have such a robust health plan, in what way do we bring in the private sector? And what kind of health products would the private sector be looking at to make sure they churn out to consolidate the government plan? Because obviously the government plan in the health sector may not be able to take care of the whole 200 million population in Nigeria.
PPP, in my project in the doctor, we did a PPP team project with my colleagues. Some of them was from California, Texas, and all of that. Interestingly, they said we should study in Nigeria in terms of people. So we came up with a proposal. It's simple and straight. The government should open up the healthcare sector, bring in enabling environment in the rural areas where private sectors can come and pick up some general primary healthcare center and revamp them on a PPP basis and equip them and run them. Other and the sharing formula. In UCA, they do it. In the urban center, they do it. In Lagos, you have a lot of PPP running up. The Tinubu Diagnostic Center is a PPP project going on, right, in Lagos State. If you go to Benin, Ibadan, University, they all have PPP. The same they should do in the primary healthcare center. But however, the environment must be enabling. The healthcare worker has to be safe in that place. Because you don't send someone there, then the person eventually not kidnapped. So they have to guarantee security. The right infrastructure has to be in place. If the government wants the private sector to come in, there are a lot of players who want to play there. What about PHCN? And hospitals do not run without you providing light. Are we going to be running on solar system? The government needs to provide that. Or is it the private sector that will now come and install the solar system, the solar light there on the primary health center, equip the place, run it, and recoup its investment. And after some time, hand it over. However, there's also a risk there that we also put because of government incontinuity in government policy. The government comes to, oh, sorry, we are PDP, we are not APC, we are this and all this. Stop, they abandon the project. If a private sector person goes into the PPP within the primary healthcare, there must be an enabling act that will protect its investment, that irrespective of any government that is in power, that its investment is guaranteed. That need to be passed, and there has to be a law with a protection. Then you see that this is not just only Nigerians other investors from mostly from India, they will take over our primary health center, they will equip them, and we'll see a functioning primary health center that is being where the private sector can play freely, invest their money because they know that at the end of the day, they are guaranteed of recouping back their investment.
Okay, if we look at the primary healthcare centers, they are actually under the purview of the local governments because they are at the grassroots, and the local government is a tier of government that is directly in charge of those locations. But we still find the federal government committing or saying they committed funds to it. What should be the role of the local government to complement the efforts of the federal government, being that these primary healthcare centers are within their locality and so they fall directly under just jurisdiction? You talked about security being provided, the enabling environment. So how should the local governments come in to assist to provide this? And let's also look at the services that are rendered in primary healthcare centers. Now, I've seen primary healthcare centers that are even within urban centers where they run more like collector services. You go there are hours of the day you can even find people there. And these are situated within the urban centers. Is it that a primary healthcare center just offers remedial services, or they should operate like full-scale hospitals? Please enlighten us.
Multiple questions, but I'll try to take each of them as you ask. In case I miss anyone, you just call my attention to it. Now, the primary care centers are the first points of contact. They are not meant to offer a full-fledged care like the general hospital. They are supposed to serve as a place where people go. Maybe you have cases like malaria, and maybe you need to be treated for. Some of them can even be equipped to take care of what? To take care of delivery, depending on where you have the next general hospital. But where the proximity between the primary health center and the general hospital that is meant to offer secondary care is nearer, the primary health care center will serve now as a cluster. For cases they cannot handle there, they will transfer them to the general hospitals. And for cases the general hospital cannot handle, they will now move them to the teaching hospital where you have all hands can take care of them. Now, cases like, let me talk about malaria. Malaria, if a primary health care center is working, imagine I'm in Lagos, and let's assume that Ekpe do not have a general hospital, and they have a functioning primary health center. Why should someone travel all the way from Ekpe and come to Marina to come and receive care if the primary care center in Ekpe is well distant, or Ejede in Ekorodu is working well? In Lagos, they are all working, so they don't need to come all the way, except for cases they cannot handle. Why should a pregnant woman leave Ejede and come all the way to Ekorodu General Hospital if we have hands, people, midwives there that can take the delivery? Because before now, this pregnant woman is going for antenatal, they will know the state of it, whether she's going to undergo CS, and if it is, then before her DD, she will be transferred to a general hospital. So that need to be whether from a cluster of the primary care center that fit into a general hospital, a cluster of 5 primary health care are clustered around one general hospital to offer such services. But from design, the primary care centers are meant to deliver skeletal services. I go to your next point. Right now, yes, on paper, we say we have 3 tiers of government, but operationally, it is not so. We had what is happening when the present administration said they will giving direct fund straight to the local government. All our governors come protesting because the primary healthcare centers are judged, or the local government are judged there at point where they seal the fund. When the fund gets to the local government, when the fund gets to the state government decides what goes to the local government. Some local government are not even functioning. You need to take a walk around most of our local government. Some local government, they don't have power. Some local government, they are not good offices. Some local government, if you go to tell this a local government, you'll be asking yourself, is this supposed to be a local government? Now that the government is saying, oh, state, we want to make these people autonomous. Let's give them fund. We heard what the former governor of Edo State said when he was interviewed about the autonomous of the local government. He was on air. I listened to a discussion. What he said, that these people do not have the capacity. So if the local government chairman do not have the capacity or a leader, why was he in the first place elected as a local government chairman? Why not we empower them? Why not we equip them? If they do not have capacity, and you know there's a capacity gap, and as leaders within the state, train them. We have experts that can train them to deliver the services to the rural people. The same people, they go to campaign and ask for their vote. And after winning their vote, now they want to equip them. They are saying, no, they don't have the capacity. That was what the former governor of Edition, that was Adams Oshomole, was saying on air, that the local government do not have the capacity. And he was emphatic about it. So we don't have a system that's really working. We don't have a system in which the politician or the selected few use it as a point in which to siphon fund. Now, if you say I'm autonomy, like if you give me autonomy, you should allow me to be accountable for the resources you give to me. If I empower my managers in the office, I said, okay, run this project. I will empower you and give you the money. I wait for you to come and give me an account on how you spend the money. But this is not the case. That is all we will supervise them. I agree they are meant to be supervised. But are we really running a federal system that allows the local government to function on its own and provide the necessary infrastructure and provide the necessary security? This is a far case from what we have today in Nigeria. However, it is doable if all hands are on deck. I still come back to the point of vision. I still come back to the point of what leadership gap. If we are all willing, we can build a robust healthcare system in Nigeria. But everybody must come on deck and walk the talk and hold ourselves accountable. We have a blueprint in which we can hold ourselves and we can measure our progress. In Lagos, which I keep referencing, right? I've spent 30 years in Lagos within the healthcare space. I can tell you that this is right from what Idris, Dr. Idris, who was the commissioner for health in Lagos State. You can clearly see milestones of deliverables all throughout his period of about 16 years as a commissioner for health in Lagos State. Then came the next commissioner for health. You can trace what they are doing. The same thing also with I think Ogun State has also key in, but I've not had the time to go around. I don't know what Oyo State is also doing the same thing. Then what about the far north? Which is a far cry, like in the northern states, where at times if you go, you look at the primary care health center, you see, you can't imagine your kid or your daughter or son going to that place. Infant mortality rate is so high. Why? Because the system is not working. They are not making policy statements that are not what actionable.
I think that's quite a brilliant submission. Earlier on, you spoke about the role of the PPP in actually strengthening the primary health care system in Nigeria. But my worry here is the poverty level at the rural area. Will you have rather agreed to government actually channeling this 1 trillion into health insurance scheme to enable those rural dwellers to patronize private participation in that sector?
Wonderful idea, wonderful innovation. You know, the world today is about innovation. Now, if we come out and say, okay, fine, if we channel it because of the poverty level, whoever is coming to play within that space, understand that you're going to deal with people who really do not have what, may not have what, cannot pay out of pocket. If a certain percentage of that amount of money is channeled through health insurance, but the health insurance can only function where you have a functioning primary health center. So a part of that fund also should be used to equip those places. Then if the private sector comes, assuming I decide to invest it, I will know that, okay, the government is paying X amount of money. But mind you, it has to be sustainable. The policy has to be sustainable. Not when a private sector person comes in, one government comes in and suspends it. We had what happened to the scholarship that was given to some healthcare students who went abroad to school. A different government came and suspended, and our Nigerian, our colleagues, and some of our students were stranded. They started crying to the news media like you, where I don't know whether they eventually intervened. Some of them were left stranded. There were no allowances because a different policy, a different government was in power. In this case, if it can be worked, if the actors, the stakeholders that are within this space are called into the bottom, and there is a workout plan, why not? But you know what? These guys will not want to do it because they know there may not be money there on the table for them to share. I say it with every sense of responsibility because there are empirical data out there where project has been awarded and yet implementation is not done and nothing has happened about it. The people are busy walking the streets because what? These projects were given to their political friends or political fathers. Let me quickly mention, during the COVID-19, a lot of centers were set up for the COVID. Many equipments were brought in. What are those equipment? Across virtually most of the federal teaching hospital, beds were brought in at a treasure price because during the COVID period, the developed countries didn't want to export their beds or their equipment to other countries because they were keeping those equipment for their own use. But somehow some of those equipment through government intervention came in. What are those equipment today? What are the centers? Have those equipment, have they not moved to some private hospitals? Where are those equipment that was brought in? So much was spent during the COVID. In Lagos, they set up a lot of centers with the hospital beds. In Bagada, we have it. On the Koroduro, we have so many of them across the school. Where are those equipment? Where are the ventilators? Where are the hospital beds? Those beds, if those beds have not been taken by someone, they should be channeled to the private health. That would do a lot in the primary health care center. But they are nowhere. That money has gone to what? Gone to what? I don't know. But no one is accounting. No one can be held accountable for it. So I think, like I said, if the money can be channeled into health insurance, who will help alleviate the pain of paying out of pocket because the people don't have it, and there's a clear implementation plan, transparency and accountability and sustainability, this will go a long way changing our healthcare system. If only the actors and the principal really want it to work.
Much, Doctor, for speaking with us today, Dr. Austin Eginong, who is a co-founder, CEO, Paper Care Healthcare Limited and brand Matrix Consulting Limited, and also Leadership and Performance Management Institute. Thank you for the wealth of knowledge that you have brought on today as we discuss the issue of primary healthcare centers in Nigeria.
My pleasure having you. Thank you so much for having me. Have a wonderful day.